Welcome to the start of a new work week. You're watching the Daily Report for Monday, December 13th. Vaccine verifications are required in quite a number of establishments starting today here in Korea. We have more on this requirement and its reasons later on the program. Here first is a broader pandemic update. I have Kwon So-ah standing by. So what's the latest here on the local front?
Sunny, Korea has reported its highest ever figure for a Monday, this Monday, and that is more than 5,800 infections that have been tallied as of 12 a.m. and it includes 5,783 domestic transmissions and 34 cases from abroad. Now, by region, we are seeing many red places in the country on our map, which means places with more than at least triple-digit figures of infections, with the highest caseload, again, in the capital Seoul, over 2,500, followed by more than 1,360 in Gyeonggi-do province and close to 400 in the city of Incheon. And with that, Korea has now been seeing, as I said, the highest Monday caseload after infections in the 6,000s, even close to 7,000 over the weekend. And this figure marks a rise by around 1,500 infections on a week. And also the country has reported 40 additional fatalities, raising the death toll to 4,293, and the total caseload has surpassed 523,000. The number of patients that are currently in severe or critical condition has been in the 800s now for the 6th straight day. And this makes vaccination the more important. We've got, because it was a Sunday, not a high number of vaccinations administered over the weekend, but the number of booster shots is higher than the number of people that got their first and second doses yesterday, standing at more than 7,700. And that's now 12.4% of the nation's population that has been administered with an additional dose. Let's move over to the numbers abroad. There's been a rise by around 440,000 new infections and more than 4,200 COVID-19 related fatalities. And a milestone has been set here in Russia here, which has become the 5th country in the world to surpass the 10 million mark. And then we've got here a country that has surpassed 9 million over the weekend, which is Turkey. And the Netherlands has surpassed the total caseload in the Philippines in the past day, with resurgences in this country as well. And those are the general updates that I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, so as I mentioned earlier, fresh that is, prevention guidelines are in place as of this Monday. And for details on that, I have Shin Yeon here in the studio. Yeon, good to see you again.
Thanks for having me, Sunny.
Right, so do start us off with the new measures in place to tame the latest transmissions.
Sure. For starters, from today, anyone aged 18 to 59 who has been fully vaccinated for more than 3 months can book their appointments for booster shots. Now, this comes after authorities narrowed the interval between primary and booster shots from what was previously known as 4 or 5 months to just 3 months. And the first of these booster shots will be administered on Wednesday. Those over 60 can get their extra jabs without booking an appointment. Walk-in vaccination services for the elderly are part of the government's efforts to encourage more booster uptake among senior citizens. Health authorities have noted that breakthrough infections were responsible for around half of the critically ill cases and deaths among people over 60. Also, starting on Monday, everyone has to show their vaccination status using a QR code or submit a negative PCR test result taken within the previous 2 days to access most public facilities. Now, this includes restaurants, cafes, and movie theaters. Last week, authorities extended these vaccine pass requirements to most businesses and venues with a 1-week grace period to help them get up to speed. That grace period ended on this Monday, so the measures are now in full effect with no exceptions being made. Businesses who break these rules will be fined roughly $1,300 if they're first-time offenders. A second violation will cost them around $2,500, and repeat offenders are subject to temporary or even permanent closure of their businesses. And individuals who break these rules will also be fined around $85.
Right, $85. And those aged 12 to 17, meanwhile, Yeon, will be required to share proof of vaccination starting next February. January, right?
That's right.
Right. And in the meantime, I hear authorities are doing all they can to boost inoculation among these young teenagers. Tell us more.
Right. That's why a vaccination outreach program for these teens are set to kick off from Wednesday. And medical staff will be visiting schools to administer vaccines to students on site. An education ministry survey has shown that more than 80,000 students at 8,374 schools are willing to get vaccinated at school. And this comes after authorities announced that vaccine passes would also be required for teens starting next February. Now, this means that proof of vaccination would be required at libraries, academies, and cram schools. Many students and parents say these measures are basically forcing teens to get vaccinated if they want to continue studying. Some parents are also asking for more clarity from the government regarding the potential side effects of COVID-19 vaccines in children. In response, authorities said they would provide data on the efficacy of vaccines in younger populations as soon as they become available. They say vaccinations have been 100% effective so far in protecting teens from deaths and critical illnesses.
All right, here and then. Thank you for now, but stay with us for the extended talks. Right, Seoul's top official, health official that is, meanwhile, has voiced concerns of the trend of recent transmissions. And for more on that, I turn now to Soa. Right, Soa, tell us more.
Right, Sunny. So the health minister, Kwon Dok-chul, started the new work week by telling the public that the country is dealing with an unprecedented crisis regarding COVID-19 and saying that medical capacity is nearing its limits. Now, Kwon said it's difficult to predict the situation from here on, citing a surge in COVID-19 patients by 38% last week from the previous week. He also expressed concerns over the number of patients in severe or critical condition nearing 900, despite the continuous efforts to expand hospital beds, including the implementation of a string of administrative orders to add ICU beds in and outside the capital region, along with such an order at major general hospitals just last Friday. The minister did not rule out an emergency situation in which current levels of containment efforts won't be enough. With that, he stressed that this week is in particular important in following existing measures. Let's take a listen.
사망자 급증이나
To prevent the worst from happening, such as an increase in deaths or a lockdown, we need fast testing, quarantine and treatment, compliance to prevention guidelines, and on top of that, vaccinations and a thorough implementation of the vaccine pass system.
Now, regarding the even stronger measures that officials have been hinting already last week, an official, Son Young-nae at the health ministry, told reporters behind closed doors today that this kind of measure is still being under review, but no details have been set yet. So it depends on the situation this week, whether it worsens or not.
Right, I see. I understand Kwon, meanwhile, has also highlighted the importance of additional doses, Soa.
Right. The minister, Sunny, said he especially called on the elderly population to get their third jabs, especially those with weakened immune systems, renewing that booster shots are not a must, are a must now, of course, for them and not a choice. Kwon referred to latest studies that showed a 10-fold higher efficacy in people who received 3 COVID-19 vaccine shots compared to those who got 2. There was a 20 times higher prevention against severe symptoms. He also cited researchers in Israel that claimed protection from the Omicron variant soars 100% with a Pfizer booster shot. With that, the minister called on everyone that's now eligible, meaning who has passed 3 months since his or her full vaccination, should hurry up in getting their extra jabs.
Right. Now, Yeon, so I just mentioned the Omicron variant, and I understand new cases of Omicron infections have been reported here in the country, right?
Right. We've seen the number of total Omicron cases hit 114 as of today. 24 were added on Monday. And of the total cases, 88 were transmitted locally. And what's also concerning is that Omicron is spreading via cluster infections here in the country. The first cluster outbreak had been traced back to a church in the Incheon area. The latest outbreak was reported in the Jeollado province, where an international student first transmitted the virus to his family members, and the strain later caused more infections at daycare centers in both Jeollabuk-do and Jeollanam-do provinces.
Right, I see. Meanwhile, so what can you tell us about the global Omicron situation?
Well, according to the World Health Organization, at least 63 countries have now reported of these Omicron variants, and that's in all 6 WHO designated regions. Now, most recently added countries in the past days were Bahrain, Mauritius, Cyprus, Malawi, and now there are more forecasts from the health organization that this Omicron variant might surpass Delta in the spreading speed. It is still not clear why the strain is spreading so fast, but given the latest available data, it is likely to outpace Delta in places where community transmissions are occurring.
I see. And over in South Africa, so I hear the president there has been infected with COVID-19.
Yes, Sunny. South Africa's President Cyril Ramaphosa tested positive for COVID-19 on Sunday local time, according to the country's presidential office. Now, the 69-year-old leader is reportedly showing mild symptoms and is being treated in self-isolation in Cape Town and monitored by the South African Military Health Service. A statement said Ramaphosa said his own infection will serve as a caution to the nation's people to remain vigilant and to get vaccinated. President Ramaphosa has delegated all his responsibilities to Deputy President David Mabuza for the next week. While it was not detailed in reports which strain Ramaphosa got transmitted with, South Africa is currently observing a resurgence driven by the Omicron variant, with around 70% of recent cases traced to this variant. Following daily infections at around 200 in early November, cases in recent days have even surpassed 20,000.
Right, and the UK has also seen a surge in Omicron cases. As of Sunday, the tally reached 3,137, and Omicron has been doubling every 2 to 3 days in the UK. That's why Prime Minister Boris Johnson on Sunday urged for more active participation in the country's booster shot campaign. Take a listen.
No one should be in any doubt. There is a tidal wave of Omicron coming. And I'm afraid it is now clear that 2 doses of vaccine are simply not enough to give the level of protection we all need. But the good news is that our scientists are confident that with a 3rd dose, a booster dose, we can all bring our level of protection back up.
Right, and Israel has also been seeing an uptick in Omicron cases. It added 22 more infections on Sunday, bringing the total to 55. Now, amid the spread of Omicron, the number of daily COVID-19 infections in the country also jumped from the 400s back to the 700s, and that's why the Israeli government has decided to roll out tougher restrictions. Authorities said they would make a daily determination of which country to add to their red list of countries where travel is banned in both directions. Israel also decided to extend its green pass restrictions, which are basically vaccine passes, to shopping malls, barring entry for unvaccinated Israelis.
Right, I see. Meanwhile, so let's end today's session over in the U.S., where I understand authorities have marked some grim milestones.
Right. Recently, the U.S. has hit 50 million infections in total and now also has surpassed 800,000 COVID-19 related deaths. The highly transmissible Delta variant has been largely attributed to rising fatalities despite the availability of vaccines. The U.S. has lost more lives over COVID-19 this year than in 2020, with health experts saying most deaths this year occurred among the unvaccinated population. It took 111 days for fatalities to soar from 600,000 to 700,000, while it took just 73 days from 700 to 800,000. The Delta strain still accounts for 99% of COVID-19 infections in the U.S.
All right, so as always, thank you very much for the update, and Yeon, thank you for your input.
Thank you so much.
In our headlines at this hour, President Moon Jae-in and his Australian counterpart Scott Morrison have agreed to boost collaboration in a number of ventures, including carbon neutrality, hydrogen economy and digital transformation. The agreement came in Canberra on this Monday and also comes amid 60 years of diplomatic ties between the two countries. Both leaders also agreed to enhance bilateral relationships to a comprehensive strategic partnership. Meanwhile, speaking at a press conference after the summit, President Moon dismissed the possibility of Korea staging a diplomatic boycott of the Beijing Winter Olympics. And staying in Australia, authorities there have inked a deal to purchase $800 million of Korean artillery. Canberra is buying 30 units of the K9 self-propelled howitzer to become the 7th country in the world to purchase these weapons. Also, 15 fully automated robotic ammunition resupply vehicles are in the deal, which was signed during President Moon's current state visit to Australia. Over in Britain this past weekend, top diplomats from Seoul and Tokyo met on the sidelines of the Group of 7 foreign ministers meeting and reaffirmed their differences over historical issues. Our Yoon Jung-min reports.
South Korean Foreign Minister Chung Eui-yong and his Japanese counterpart Yoshimasa Hayashi met for the first time on the sidelines of the G7 ministerial meeting in the UK, only to reaffirm a frosty Seoul-Tokyo relationship over historical issues. Seoul's foreign ministry says they briefly met at a reception over the weekend, and Chung made clear the Korean government's stance on Korean victims of wartime forced labor and sexual slavery. Chung called for dialogue, adding the two countries have a lot to work on together. Japan's Kyodo News reported that Hayashi demanded, quote, appropriate measures from South Korea regarding the thorny issues, reiterating Japan's earlier stance. They have agreed to continue close communication between Seoul and Tokyo. On North Korea, the two ministers confirmed the importance of cooperation along with the U.S. for the denuclearization of the Korean peninsula. The Japanese foreign minister only took office last month, and the two officials had begun the reception by exchanging friendly greetings. The South Korean chief diplomat also met with his U.S. counterpart Antony Blinken at the G7 over the weekend. They discussed issues on the Korean peninsula, Northeast Asia, and the Middle East, while reaffirming the strong Seoul-Washington alliance. Chung also held a series of separate meetings with his counterparts from Australia, the UK, and more, stressing the importance of cooperation on various sectors, including economy and health. At the expanded G7 ministerial meeting, South Korea shared its experience of democracy and discussed recovery from the COVID-19 pandemic, as well as resilience of the global supply chain. Yoon Jung-min, Arirang News.
Right, staying with the G7 ministerial talks, participants have also called on Russia to refrain from a military campaign against Ukraine, warning of severe economic repercussions. Our Kim Da-mi has more.
Russia will face massive consequences and severe costs if President Vladimir Putin attacks Ukraine. That's according to G7 delegates who warned in a statement on Sunday that they were united in their condemnation of Moscow's military buildup near Ukraine, urging Russia to de-escalate.
We've been clear that any incursion by Russia into Ukraine would have massive consequences for which there would be a severe cost.
Reaffirming their commitment to Ukraine's sovereignty and territorial integrity, the G7 foreign ministers further pledged to intensify their cooperation under a common and comprehensive response without giving specifics. The G7 members also expressed their concerns about the, quote, coercive economic policies of China. They have long sketched on the development finance initiative to counter China's increasing financial influence on developing countries such as in Africa. After calling out China in a joint statement for the first time in June, the delegates said Sunday they reaffirmed their pledges and stances issued in that statement. Speaking at a G7 news conference in Liverpool, the British Foreign Secretary said the delegates want to build the investment and economic trade reach of like-minded, freedom-loving democracies in a message directed at Beijing. Also included in Sunday's statement was North Korea, where the foreign ministers urged Pyongyang to restrain provocations and instead engage in diplomatic procedures, echoing the joint statement issued at the G7 Foreign and Development Ministers meeting in May. The G7 also pressed Iran to agree a deal to curb its nuclear ambitions, underlining resumed talks in Vienna were the last chance for negotiations. Kim Dami, Arirang News.
December marks the 25th anniversary of Korea's accession to the OECD. Accordingly, in this next report, our Kim Sung-min walks us through Korea's economic advances over the past years and its plans for the years ahead.
Exactly 25 years ago in 1996, South Korea became a member state of the OECD based on 3 decades of dramatic economic growth. In that time, the country had grown its GDP per capita by 123-fold, an achievement dubbed the Miracle on the Han River.
Here in the middle of Seoul is the Han River. The Miracle on the Han River changed the area behind me from muddy ground to highways and skyscrapers in a few short years. But after such dramatic growth, the next question was how to keep it going.
In that task, South Korea had a partner in the OECD. There, South Korea could learn from its fellow member states to figure out what types of reform will work best as it moved towards a market economy.
This involved a greater exposure to competitive forces, better governance for financial institutions and corporates, as well as a more flexible labor market coupled with a stronger social protection.
And in the 25 years since then, South Korea has proven that the so-called miracle was not a fluke. It's now Asia's 4th largest economy, with a GDP that's grown another 2.7 times as of 2020 to $1.6 trillion. Last year, its exports were the world's 7th largest. But while South Korea has come a long way, the journey's far from over. In the background of this dramatic growth are some of the most pressing issues, like an extraordinarily low birth rate. The country's total fertility rate has been steadily decreasing to a new all-time low last year of 0.84, the lowest in the OECD. Gender inequality was a serious concern back in 1996 and is still lists today, South Korea having the OECD's biggest gender wage gap. So what does the country's path forward look like in the next 25 years?
As far as social issues are concerned, the Nordic European economies are perhaps a good example to get inspiration from, because they have achieved flexicurity, which means combining more flexible labor markets and a less dualistic labor market than the one in Korea, with a higher degree of social protection than is offered right now in Korea.
Now, what about the people? How do they want to shape the next 25 years? They generally agree on one thing.
I hope that in 25 years, South Korea will have equality.
Equality, because even as a grown-up person myself, I can sense that young people and teenagers are not given fair opportunities.
I just want to tell other young people in my generation, those who will lead the country in the future, not to give up, because we will have our time to shine.
Kim Sung-min, Arirang News.
Meanwhile, in other news, rescue operations continue across 6 U.S. states as survivors reel from the aftermath of deadly tornadoes this past weekend. Our Kim Yo-san reports.
Rescuers worked through the night searching for survivors from what could be the longest tornado in U.S. history that left a trail of destruction across 6 states from Arkansas to Kentucky. Hardest hit was Kentucky, where streets were left turned in rubble and debris from collapsed buildings. Authorities say that despite emergency warnings, the size and power of the tornado was devastating.
There were lots of warnings, and in fact, even at that factory, there was a warning for people to get to the right area. But this storm, it's like nothing any of us have ever seen before, even in a movie or on TV. It is that devastating. I mean, homes totally gone, and the people inside them totally gone too. This is something so devastating. The warnings were there. I don't fault anybody for that.
Dozens of people are still unaccounted for in Kentucky, where at least 100 people were believed to have been killed. The powerful twisters destroyed a candle factory, as well as fire and police stations in a small town in Kentucky, ripped through a nursing home in neighboring Missouri and killed at least 6 workers at an Amazon warehouse in Illinois. According to AFP, over 70,000 people are left without power in Tennessee. President Joe Biden has approved an emergency disaster declaration for Kentucky and vowed to support other states affected by the tornado.
But whatever is needed, it's within the authority of the President of the United States and the federal government to provide that help. And we're going to provide whatever is needed.
The storm was all the more remarkable because it came in December as colder weather normally limits tornadoes. Kim Hye-sun, Arirang News.
Up next, advances in technology here on the local front are looking to dramatically change our conventional ways of holding meetings and trading stocks. For more, I have Ji Lee here in the studio. Ji, welcome back.
Hi, Sunny, and thanks for the welcome. Right now, we're sitting side by side in person, but come next year, we could be joining a studio virtually as holographic projections of ourselves. Metaverse startup DoubleMe plans to commercialize hologram-based mixed reality as a business-to-consumer service as early as the first quarter of 2022. Industry insiders say whether hologram-based meetings can gain traction depends on building holograms in the digital space that accurately reflect individuals in the physical world. There have been unidirectional concerts and educational content using holograms, meaning the holographic content was only visible on one side. But with the new development, users can easily and independently create their hologram within the system, so everyone can join in on the conversation as their virtual selves, as opposed to being passive consumers.
Right. Gee, I would assume that even post-pandemic, this virtual approach will gain ground, given its convenience, right?
Probably. So India-based BIS research estimates the global holographic imaging market to nearly triple by 2025.
So how does this actually work, G?
So as you can imagine, there needs to be a 3D camera and a wearable device like an Oculus Plus, for example. So using artificial intelligence, the company creates holograms based on photos taken with a 3D camera. Users can view other participants appearing as holograms with wearable devices. Down the road, however, the plan is to also allow those without 3D cameras or wearable devices to view the hologram content on their smartphones or computers. On the back end, a combination of computing power that can process large amounts of graphics data and low latency communications infrastructure is a must. These factors are also the reasons why B2C hologram services have not yet been commercialized. DoubleMe is working with SK Telecom to enable faster data transmission and reception. Telecom companies are bullish on hologram content as they will be able to market it to bolster demand for 5G services. An industry insider says video streaming services like YouTube and Netflix have been the main products, prompting users to switch from 3G to LTE. Now, to sway users from LTE to 5G, the industry needs a product more generally accepted than online games.
Right, I see. And moving on, G, now tell us about this Korean startup that is looking to transform the way we trade stocks in financial markets.
Sure will. So a domestic startup beat Intel and built a microchip that dramatically lowers trading time. Korean startup, about a year old, has succeeded in creating a microchip that speeds up trading by a few microseconds, a huge difference in the world of finance. Prior to Rebellion's new development, Intel's Habana Goya was the fastest AI accelerator in this field. The AI accelerator, dubbed Ion, was released last month and is 30% faster than Habana Goya. Its electricity consumption rate is also much lower than the Intel counterpart.
Right, I see. And how was this feat made possible, G?
So what makes Rebellion really unique is that it's customized for use in the finance sector, of course, in addition to being the fastest. Currently, major financial institutions are mostly using NVIDIA's GPU A100, which can be used in many different industries. And despite the massive success, though the company says it merely benefited from the best chip manufacturing environment in the world, created by Samsung and SK Hynix. In fact, Samsung was the first to contact the startup for collaborations, and the two will jointly build their next AI chip Atom to be used in data centers. That's all for me today.
All right, as always, thank you very much for that coverage.
Thanks for having me.
Korea's daily tally has been hovering more or less on the 7,000 level, while its number of serious infections stands close to 900. Accordingly, starting on this Monday, tougher prevention guidelines are in place, but health authorities have spoken about the possibility of imposing greater restrictions should the current challenges persist. For more, I have Professor Yu Byung-wook from Suncheon University. It's a pleasure to see you again, Professor Yu.
This is my pleasure.
I also have Professor Lee Hoon-sang from Yonsei University live on the line. It's good to see you too, Professor Lee.
Thank you for having me today.
Professor Yu, we'll start in the studio as always. Let's begin with your thoughts then on the current COVID-19 situation.
Well, some experts in the overseas said diagnosing Korean condition is the word is clueless, someone said. But the point of my view is not, because it can be a natural, spontaneously happening, because the end of the immunity for 6 months past the second shot. At the same time, Korean government decided with the corona relaxing of the social distance, and the cold weather is a triple the bad thing is coming together. The people are start to forget about seriously the COVID-19. That's why this result comes now. We can have it.
I see. And Professor Yu, what is your forecast now regarding the current situation for the weeks ahead then?
So I think for the foreseeable time being, because there had been reduced level of the social distancing, and also with the it will take some time for the third dose of the booster dose vaccination rate to increase in the population booster dose vaccination rate. So for the time being, at the current level of the social distancing, and also, even though the government raised the social distancing level, it will take some time for that to have the effect. So for some of the foreseeable time, I think the current trend of the high level of the confirmed case happening will continue.
Do you expect the daily tally, Professor Yi, to perhaps surpass the 10,000 mark in the near future?
At the moment, without any kind of a drastic government policy, especially in the strengthening or heightening of the social distancing level, and also with people keeping current level of gathering and meeting and participating in social activities, it might continue in current level.
I see. So you do believe that tougher restrictions are in order then? We would need them?
I think without that, I think it may not be not so easy to control the current transmission level.
Right. And before we discuss about the perhaps tougher measures then, Professor Yu, perhaps you could tell us a bit more about what you believe is fueling this latest outbreak here in the country.
Well, in point of a scientist, as a medical doctor, actually there is no evidence in its own Korean data. When we start to relaxing as for social distance, we're catching some data from US and the European countries. They said at least after second shot, so immunity goes more than 6 months and will be more, and we are considered booster will be covered all. Also, Delta variant, it happened in Koreans and other countries, probably passing very mild. But we don't have the exact evidence how we can treat it and handle it, put our policy. So our neighbor country in Japan, so it's ridiculously, there are very less patients confirmed and very less the death rate. So someone said, if there are mild variants, it can be the goes around in Japan. Their own data say they have the fully immune, even they didn't vaccinate it, because around the Olympics game, many people exposed and getting COVID. That's why they got now period of national and the normal natural immunity periods. Probably period will be gone. But unfortunately, Korea is like a window period, weak point. Weak point, we open it. That's why it can be outbreak, like a balloon about to burst out. So unfortunately, so from now on, people we can get a mistake, but we not do mistake again. So from now on, when it started with the booster or third shot this moment, we have to get the evidence with the sampling or whatever in the Korean people's the data that will help to prepare for third or the 4th or 5th booster shot in April or March next year.
I see. Professor E, as part of efforts to better contain the situation here in the local front, vaccine pass requirements have been broadened starting on this Monday. Now, how effective does this measure look to be in your view, Professor E?
I think vaccine pass might have effect to a certain extent. But I think the focus, the important focus should be not only on the vaccine pass itself, but what is important will be raising the quickly raising the booster dose vaccination rate, and also even for people above 80 years old. There had been some of the vaccination rate of 80% had been reported. So we are just trying to have this vaccine pass to increase the vaccination rate, but also to protect for those people who had not been, who are not protected. So we need more than just using of this vaccine pass.
Right. Professor Yu, health authorities have also shortened the interval between primary and booster shots to 3 months for all those aged 18 and above. Now, having said that, what are your thoughts on the efficacy and safety of additional doses?
Well, first of all, safety matter, I guarantee will be fine, because our main concern is anaphylactic shock. Usually the first shot or even the second shot, it can become as like allergic reaction, immediately happen. Sometimes be delayed, like a myocarditis, something inflammatory is the heart. It can be delayed, but I believe the safety measure is fine. But my little concern is there are two major principles about the vaccination in the minimum age and the minimum interval. For example, hepatitis B, we need 3 shots. First, second is at least 1 month. Second to third, we need 3 to 4 months. But if we have an opportunity to have a shot short to the last third one, if the doctor, we can say, third one, it doesn't work. Why? Time is very short. Because the immune system is a little difficult to explain in all, like a B cell memories and the T cell to immediately react it. So probably that's why we recommend, so Pfizer is at least 3 weeks to depart from the first and second, and the other one, the 4 weeks to depart, because it helped to make the enough immunities. So now only UK and Greek and Korea, the third country, started for 3 months the difference to the shot of time. But we need the evidence, it's working or not. But probably the safety matter is fine, but if it's working good, will be fine. But if it's getting shorter, so the third shot will be not working properly. This is my concern.
I see. Professor E, now, Professor Yu here in the studio has spoken about this a bit earlier. He talked about the possibility of additional shots in the form of a 4th or a 5th booster taking place sometime in the spring. What are your prospects on additional doses following the booster, the 3rd dose?
So I think at this moment we cannot exclude the possibility that we might need the 4th dose or 5th dose thereafter. But at the moment, I think we will have to have more data after this 3rd dose booster dose vaccinations had been rolled out. But at least for those people who are in the immunocompromised situations, the US CDC had been already recommending 4th dose for people with compromised immunity level. So I think we cannot exclude the possibility that maybe sometime next year or in the early next year, maybe we might need 4th dose. But I think before we decide on that, we will need more robust data after the 3rd dose booster vaccinations.
And staying with booster shots, Professor Yu, what are your thoughts on the possibility perhaps of offering booster doses to those aged 12 to 17, later on that is?
Well, for my chance to answer about it, so but because the teenagers, so it is a certain group who are at a major risk, like asthmatic conditions, and who underline the chronic illness, they have to have a vaccination. I 100% agree with that. But before we move that, is recently the end of November, Indonesian government approved the Novavax one. But Korean governments and our health authority process of approval of Novavax, but still be delayed. Before we move to give a shot for our children and adolescents and the teenager, please, if we give them to more opportunity to choose for the Pfizer one or the Novavax one, probably the parents and the students, teenager will be followed because vaccine is not compulsory, it's following our own will. Anyway, third or booster shot for the teenager one, what the Professor Lee, he comments, after the third shot in the ongoing in Korean population this moment, we have to be sure the low data of February, March, and then we can be applied for a teenager safely, and we have to show the efficacy and how it works exactly for our more than 18 years old. And then Korean data will help to show the parents and the teenager to going on to consider a third vaccination.
I see. So we'll have to wait for data from booster doses for those aged 18 and above before we decide on booster doses for those aged 12 to 17.
Correctly.
Professor Lee, what are your thoughts?
So I agree with that. We will need quite robust data. But as soon as we get those data, I think it is highly likely that it might be quite recommendable for those teenagers between 12 to 17 to be vaccinated. But I think what is important is for the government to have very careful and very considerate and very engaging health communications approaches with the students themselves and the parents of those students. Rather than like very compulsive approaches, but very engaging approach with a very considerate communications with those who will be vaccinated and those parents of those teens who will be vaccinated.
Right. And staying with booster doses, Professor Yi, how do you respond to doubts about the efficacy of third doses in light of post-booster infections?
So, I think there had been, there can be some of the breakthrough infection even after the third dose, especially with the current Delta and like Omicron variants. But I think what is important is not only the aspect of completely minimizing the possibility of the breakthrough infection, but even though there can be some level of the breakthrough infections, still the third dose vaccine will reduce the hospitalization rate and reduce the development of severe case and mortality rate, and also it will be quite helpful for protect against the Omicron variant, which seems to be possible to become a dominant variant. And also, especially, it will be important for people age over 60s and with the underlying conditions, for them to avoid any possibility for hospitalization and developing severe case and have a mortality cases. I think third dose will be still very important.
Right, and speaking about the third dose, Professor Yu, as of now, the booster inoculation rate stands at around 13%, 12.4 to be exact here in the country. How does this particular rate compare to those of the first and second inoculations, and what more perhaps could be done to further boost it? Even this winter season, we are on the crisis. Probably it's a little difficult to make like our second shot, because our complete second shot rate is around 80%. But I couldn't expect it same as like the second shot for the complete the third one, because the reason why people are still just, they are hesitated. Some the news coming said after the second shot of the, for example, Pfizer, only 2 months ago, and the Omicron, working against the Omicron, only 20 or some %. So they don't convince anymore the vaccination. Also these days, the teenager and parents are a little bit of protest against the government will, because they didn't show any order to the data exactly for the Korean people are. But exactly we have to do now, more than 50 or 60 years old, who are passing more than 4 months after the second shot, yes, they need the vaccination, even since the Omicron and other variants doesn't work well. Why? Because the booster one, after the 3-4 months later, anyway, it helped to make our neutralized antibody against any action on the virus. So we have to show
data to who are follows and they believe that. You know what? More than 65 years old peoples, they're annually after 2015, we gave opportunity to free shot for national immunization program for the influenza. Automatically they have it because they believe governments convinced to give the opportunity to have an influenza vaccination and they believe they feel safe. But problem is now Korean people, they are front of the agitated because, vaccine pass is kind of pressure to have a shot, but the people, they feel not feel easy and feel safe for the second, more than third shot. So please show us we can follow in some of the data or as Korean one. Probably more than 65 years old people, they will follow automatically.
Right, so we need the disclosure of more data with regard to these shots then?
Absolutely.
Professor Yi, let's go back to something you mentioned earlier. So you have spoken about the need to further toughen COVID-19 prevention efforts. Could you give us some examples of what measures should be taken?
So I think the issue is the difficulty with for small business owners and for the economy, the sustainability issue of the social distancing. But at the moment, at this higher level of the COVID-19 cases developing and with the high number of the mortality cases and severe cases, I think at the moment, until we reach some level of the higher level of the third dose booster vaccination rate, I think for the time being, what we need is a stronger social distancing measure. Mask will be still very important. And especially, I think we need a very stronger measure for reduce the amount of social gathering, maybe less than 4 people, maybe like 10 o'clock curfew and work from home for companies and government agencies. So we did some stronger measure for at least 1 or 2 weeks until we increase the booster vaccinations. And I think we need somewhat more of the stronger measures to change the situation. And also, as I said again, as for the teenagers, what I think it will be important is not even only for the protecting those teenagers, but even though the severe symptoms does not appear in them, they can be carrying and transmit those COVID-19 to older aged people as well. But to really work with those teenagers for having vaccination of those teenagers between 12 to 19 years old. We need stronger evidence, but also the more stronger engaging health communications and really talking with those people, over the students and the parents about the vaccinations. And I think that and more of the stronger assurance about the vaccine safety and clear communication about the effect of the vaccine.
Right. And Professor Yu, what are your proposals to better tackle this latest outbreak? I understand some health experts have called for, Professor Yi mentioned a curfew. There are experts, health experts, who've claimed that a curfew of perhaps 6 p.m. is necessary at this point. What are your thoughts?
Well, my idea is 100% agree with Professor Lee. But furthermore, I would like to see the next March, because we're going to have winter vacation soon. School will be closed, so which means the many people is less activities and the less going around the teenager. That's why they can be a reserve, but probably the less opportunities. But the next new semester open, because Korea and Japan in the March is the new year's beginning for the school year compared to others. So which means they're going to mix and get along as well. So, which is can be now we can call 5th wave, but we have to be prepared for the prevention of 6th wave from the March. So how we can handle it? First of all, I 100% agree with what Professor Lee mentioned, is we kind of the lockdown level of the measure. But you know what? Now we are now just pause, not back to the high, strong level of restriction, because we are under the easy, relaxing social distancing just 4 weeks now. So we need the signal and decision. We have to back to the strong level of this social distance measure, or anyway, because many European countries and still US, they still ongoing easing and relaxing social distance measure. But before the March, we have to take care of, because new school season is begun, probably under chaos. Some people said now we are facing on because of school open from September, and the 12 weeks later is incubating, mixing. That's why we are facing on the fourth wave now. So before school seasons beginning, we have to be prepared for the vaccine program for children with another option like Novavax. This is what I'm insisting saying. If there are more options for the safe, parents and teenagers will follow the vaccination, and we can catching and prevent the fifth waves.
Professor, you tell us a bit more about your confidence in Novavax.
Why? Because Novavax, this vaccination is very new, but we can call the Novavax vaccination is made the same process like a hepatitis B vaccination. So actually is like a messenger RNA type of vaccination will be increasing very rapidly to level, which is level of the neutralized antibody to fight against the virus. But the Novavax one is like hepatitis B, is slowly going up, and the protein subunit recombinant one is we use quite long times, like the virus vector type. So we have a long time experience and we can handle it. So which means even now Indonesia is the fourth biggest population countries. They're using the many options because many people but still shortage of vaccination. They open and use that, and they started vaccinating for young people with the Novavax. So I believe the Korean government now under investigation for the safety measure and will approve that. So we are going to give the vaccination for children and also pregnant women and who want to have the third shot for different type from the messenger RNA. Give them two options and they will follow it. Also, not only this protein subunit like the Novavax, if we have a more option, we will follow that, and naturally we get used to, we can overcome COVID-19.
Right. I suppose the availability of more vaccines will boost our protection against COVID-19.
Absolutely.
All right, Professor, as always, thank you very much for your insights. Professor Yi, thank you very much for your time and your thoughts today.
Thank you for having me.
Right. Violations of vaccine pass requirements will result in hefty fines for both patrons and business owners. So do seek to abide by current prevention guidelines. Thank you for watching.
지겨운가요? 힘든가요? 숨이 턱까지 찼나요? 모두가 최선을 다하고 있는 이 힘든 시기에도 분명 끝은 있을 테니까. 대한민국 모두가 다시 힘낼 수 있도록 한수원의 에너지는 멈추지 않습니다. 대한민국 에너지 업. 한국수력 원자력.
When the lantern of wisdom and mercy lights up, a traditional cultural festival unfolds. All hearts connect as one. The wave of traditional lanterns that light up the heart and the world flows. Joy overflows as people experience events, performances where people come together in harmony. When flowers fall like rain on the world, illuminating